Okay. Hello.
Hello.
Hi, my name is Justine Badalamenti. I'll be your nurse today, working with you on the floor. I'm just going to start out by getting some assessment questions on you for why you're here.
Thank you.
Okay. Can you tell me your name?
Deborah Ann Saunders.
And how old are you?
Well, I'm 60 years old right now.
Okay, so you were born in
58.
1958. Okay. And do you prefer to go by a different name, or is Deborah
Most
okay?
people call me Debbie.
Okay, Debbie. All right. And what brought you in here today?
Well, I thought it was time to have a general examination, and I was thinking that maybe we could talk a little bit. I could explain my reflux.
You want to talk about your reflux?
Mhm.
Okay. All right. So, when did this start, your reflux?
About 6 years ago.
Okay. And then, how was your health before?
Oh, perfect.
Perfect health. Okay, no problems at all?
No.
Okay, and then about how often do you get it?
About once a week.
Okay.
But it usually happens if I eat wrong or after 7 o'clock. Something spicy usually agitates it, aggravates it.
Okay. And then can you describe how it feels when your reflux happens?
Well, I usually get a burning in my throat, and it will wake me out of a sleep.
Okay, so it affects your sleep.
And then sometimes it does involve some vomiting.
Okay. A lot of vomiting?
No, just a little. Just enough what happens to be in my throat. And it's not a lot.
Okay, and so once a week you wake up from your sleep, or is it more than that?
No.
Okay, and then about once a week you get the vomiting.
The vomiting doesn't happen every time.
Okay, not every time.
No.
Do you vomit when you wake up from your sleep?
No.
Okay, so that doesn't occur when you're sleeping. Okay, and so have you had like any infections or viruses recently?
No.
No? Okay. No colds, flus?
No.
Okay. And do you have any like exposure in your life to like hazardous chemicals or toxins?
No.
No. Okay. And when you were a child, did you have any like childhood illnesses?
I believe I had measles, chicken pox. I even had the mumps.
Okay, and do you have any other adult illnesses like chronic problems you're being treated for?
Yes, I have high cholesterol that I take Lipitor for. 20 milligrams every morning.
And then the Zantac.
Right, and then I take Zantac once a day.
In the morning or whenever you have an attack?
No.
Or
I generally take it about 5 o'clock at night,
okay.
which sometimes ensures then that I will not get the issue of the attack in the middle of the night.
Okay, so are you up to date on your immunizations?
Yes.
Okay, so you when was your last tetanus?
About 9 months ago.
Okay, and were you due for it, or did you?
I was due for it.
Okay. Have you had your pneumonia vaccine?
No.
Okay. Have you had a TB test in your life?
A long time ago.
And was that negative or positive?
Negative.
Do you know when you had that?
Probably about 15 years ago. Right
Okay.
before, yes.
About 2004, say?
2002, 2003. Mm-hmm.
Okay. And then, you have your flu shot? You
Yes.
had this, okay.
Every year.
And where'd you have that done?
Walgreens.
Okay. Let's talk about your surgical history. Have you had any surgeries?
I had my appendix out in 2002.
Okay. Any other surgeries?
I had a tubal ligation in 1988.
No, you had to be put under anesthesia for that?
Yes.
Okay. And did you tolerate that well? Have any problems waking up?
Oh, yes. No, I don't have any problems with anesthesia.
Okay. And do you have any family members that had difficulty waking up for anesthesia?
No.
Okay. So besides those surgeries, have you had any injuries?
I did have an injury in 1993.
Okay. What happened?
I had a boating accident.
And what happened?
I fell off the boat and my foot got hit by the propeller 3 times.
Oh, wow. That sounds painful. So what did you do
I was
after that?
I was taken to the hospital. I spent 5 days there. They repaired tendons. All of them were severed. And I had crutches for 3 weeks, a couple physical therapy appointments, and I was better.
Okay, so you did have therapy.
Mhm.
And what foot was that?
My right.
Okay. All right. So next we're gonna talk about your medications. Now I know that we talked that you take Lipitor 20 milligrams in the morning for your high cholesterol, and then Zantac once a day. What's your milligrams on the Zantac?
I believe 10.
Okay. And do you take any other medications?
No.
No. Okay. Do you take like over-the-counter supplements?
No.
Okay. And then obviously those are tablets, and then you swallow them with water.
Yes.
Okay. Do you take them with food?
No.
Okay. So besides medications, do you have any other like therapies that you do for your health? Let's say going to the chiropractor or exercise.
I do take 5 every day. I take a walk for 30 minutes.
Okay, that's good.
And it is quite a walk where I make my heart work through it. It's not totally leisure.
It's not slow. Okay.
No.
So fast paced. All right. Do you monitor your heart rate during this time?
No.
No. And you don't have any difficulties with that while you're exercising?
No, not at all.
Okay, so you tolerate it. Okay, so overall, your general health, would you say that is good, fair, poor, or?
Very good.
Okay. How do you feel about your emotional state? Do you feel down or depressed or anxious? Feel like things
No.
get you down?
No, I am. Don't have any problems with depression, anxiety, anything like that.
Okay, so let's go back to what brought you in here. You want to talk about your acid reflux. So how does that impact your life?
Well, it makes you not be able to eat the foods you really want to eat.
Okay.
For instance, my food choices can't be Mexican style, and a lot of times they can't even really contain a lot of milk products. For instance, I cannot have a bowl of cereal at 6 o'clock at night. It will not work well.
And then you can't eat after a certain time. Like
Usually
you
around
said.
6:30, I'm done eating for the whole night.
Okay. And so when you get that, it's just in your throat?
Yes.
The pain is just in your throat. You're not having any like left-sided
No. No.
pain. Okay. No stomach ache.
No.
Okay.
No.
And how long does it last?
Oh, just minutes.
Okay.
Because it wakes me up, and then if I sit up and I take a few breaths, it often will go away as quickly as it came, but then I have to sit up for a while
Okay.
in the easy chair in the living room, and then it will subside.
How long do you sit up?
30 minutes.
And this is at night when you
Mhm.
woke up. Okay. And as far as like intensity goes, could you describe like on a scale of 1 to 10 how bad it is?
Oh, it's about a 6 or a 7.
6 to 7 out of 10. Okay. Is there any other characteristics you would use to describe it besides burning and painful?
No,
No.
no, just that burning.
And what makes it better?
Well, I need to sit up, and then I'll go in and get a glass of water.
Water helps. Okay.
And then sometimes I will take another Zantac. But generally sitting up. And then even after I come back to bed, I'll put a second pillow under my head.
Okay. Here's additional pillow. And so we talked a lot about the aggravating factors. I'm just going to list them and then you tell me if there's any more. So spicy foods, eating after 6 or 7-ish, dairy will make it worse. Is there anything I missed?
No.
Okay. So besides like what foods you're allowed to eat, does it affect your life in waking up you in the night? Does it affect your life in any other way?
No.
Okay. So do you have any allergies?
No. I don't have any allergies.
So medications, food,
No.
like cats, dogs, grass? Okay. So have you had lab work done recently?
I did about 6 months ago. They ran a profile that included, I had to fast, so they said it included 20 or 23 different tests on it. I know one was a glucose and one was HDL, LDH.
So your cholesterol and probably like a basic metabolic panel.
Yes.
Okay. Okay, I'll have to see if I can access those after we're done talking. So we went over your emotional status. Do you have any religious preferences?
No.
Okay. And you did mention that you exercise every day. Is there ways that you use to cope with things? Like life stresses?
Well, something else that I find very relaxing is I like to take baths.
Okay.
If I do feel a little upset about something, I'll take a bath and read a book and Just generalized, trying to relax and do it alone with no one else in the house.
Okay.
A little bit of solidarity is good for that.
Now, are you married?
Yes.
Okay. And what do you do for work? Do you work, are you retired, or?
No, I work, and I work 3 days a week as a medical coder.
Okay. That's a tough job.
Yes.
Lots to remember.
Yes.
Yes. Okay.
I enjoy it though.
Oh, you do?
Yes. I have my own cubicle. I don't have to have a lot of interaction with people. But I just do my job and I enjoy it.
Yeah, there could be an upside to that.
Yes.
So, like your home conditions, would you say that those are safe, adequate?
Oh, very
any
safe.
Concerns? Okay. Okay, and then I'm just going to ask you a question. We have to ask everybody. We have to go over your sexual history. So have you in the past had any positive for STDs?
Oh no. I've always had very good pap smear results.
Okay, so no STDs and
No.
always normal pap smears.
Yes.
When was your last pap smear?
About 2 years ago.
Do you get regular mammograms?
Yes, once every year.
Okay. Year. All right, that is good. Any problems with those?
No. No. I think about one time, I think I did, about 10 years ago, they suspected something and I went in for a biopsy and it was negative.
Okay, so you did have a biopsy.
Yes. I don't know if it was a biopsy, if it was just aspiration. But it was something to that effect and it was negative.
Okay, I'll have to see if I can look that up in your chart. So we did talk about environmental hazards earlier. Now, where you work and where you live, you don't have any concerns for environmental problems?
No, I do not.
Okay, and I'm almost done asking you all these questions. It's very overwhelming, I know. So, were you in the military?
No, I was not.
Okay, and do you feel like you have adequate access to health care?
Oh yes, absolutely.
Okay, you feel like you can get there?
Yes.
Okay. Feel comfortable with your doctor and talking to him and stuff?
Oh yes, very comfortable.
Okay, and then I'm just going to go over a few more general questions about your health, and then we can get on to looking at how we can alleviate some of those reflux problems that you're having. So, do you have any problems with your skin?
No.
Dry patches, sores, your hair?
No.
Okay, and your nails are fine?
Yes.
Any issues with your head or your neck?
No.
Okay, and have you had any like swollen lymph nodes?
No.
Any difficulty with breathing?
No.
I know we talked about your heart while you're exercising, but otherwise do you have like any irregular like chest pain, or you feel like your heart's pounding out of your chest?
No.
Okay, everything's working good. Okay, and then we talked about your your breast exam. Sorry.
Yes.
Okay. Any issues with your breasts?
No.
Other than that. Okay.
No.
Any has the doctor ever told you that you have like blood flow problems, circulation?
No.
Okay. And then we did talk about your reflux, but you have any other stomach problems?
No, not at all.
And then do you follow a specific diet, or?
I try to eat very healthy.
Okay.
Lots of salads. Keep away from meat. Just chicken and fish, but no red meat.
Okay, that's also good for your cholesterol too.
Yes.
To keep that. Yeah, I'm sure.
Yes,
you're very
I was
good at
told that when I received that diagnosis.
Do you have any endocrine problems like with your thyroid or no? Okay. Have you ever tested high for like high blood sugar?
No.
Okay. How do you have any difficulty with like frequent UTIs or urinary incontinence?
Actually, I do.
Okay.
I find that even while I'm doing the brisk walking, that if I go to bend over or if I'm just feeling like I have to urinate, a lot of times I have a little small bit of urine come out. And if I sneeze or cough, often that will happen too, a small amount of urine.
Oh, okay. Does this affect your life in a major way?
No.
Okay.
But it is kind of annoying.
Yeah, I'm sure it could be. Yeah.
Yes.
Do you have any muscular problems? Okay.
No.
Has you have any like neurological disorders or like any issues with like memory or thinking?
No.
Okay. And you have a good health where you're not depressed or anxious. We talked about that.
No.
Do you have any other like female anatomy specific questions, like in regards to gynecology concerns?
No, I do not.
Okay. All right. Well, I think we got through everything. I'm sorry it was a long list. Do you have any more questions for me before I go and talk to the doctor about this?
No, I do not.
Okay. Well, I really appreciate you being patient. Thank you for your time.
You're welcome.
And I will be right back. Can I get you anything, like a drink of water?
No, I'm all set. Thank you.
All right. Thanks, Debbie. I'll be right back, okay?
You're welcome.